I am with Dr. Shao, like a shower.
Yep.
And we are going to talk about some general chiropractic techniques and how you guys do traditional and then you have modern things. So explain those to our viewers and to me.
So with chiropractic care, we're trying to correct any vertebral subluxations or basically anything that's out of alignment, whether that's a vertebra or a different joint in the body, like knees, shoulders, ankles, things like that. So we can do that in a couple different ways.
Okay.
And we basically just have a lot of tools in our toolbox to basically decide what's best for the situation. So we do a lot of traditional adjustments by hand, but we also have different instruments. Like this is called an arthrostim. So it's kind of like a little mini jackhammer. But I'll show you here in a minute. But basically when we're working on a joint, we can do adjustments with this if somebody has a lot of arthritis or if they have specific issues that a regular adjustment wouldn't be the best for. So when it comes to an adjustment, it's about speed and precision. It's not really about force. It's not more pressure is better. We're not going for that real hard crack.
Right.
You're trying to get that joint moving, and the faster you are, the less pressure you need to use. And these little things are really quick, really fast, so they don't take a lot of pressure. So, but we also do traditional things like the drop table. So when a lot of patients come in to get adjusted, we'll actually just have them sit down first.
Okay.
We'll just kind of go through the range of motion. So a lot of times what we'll check first, just like you would with most chiropractors, to see how well you can turn your head side to side, look down towards your chest, look up at the ceiling. Good. And then check the bend going from side here and then over here. And then a lot of the adjustments we do is if you want to go ahead and lay face down and do more traditional adjustments as well.
Now, I hold heavy children a lot all day, so
Yeah.
I'm sure there's going to be something out.
We'll check it out. So one thing that we do like to do is, of course, we're focusing on the alignment of the spine, but we also want to go over different stretches. So one of the things that I do is we work on the alignment, but we also really want to work on stretching things out at the beginning to make sure that they're equal. And then we want to work on strengthening to get things to stay. So one of the things that we work with chiropractic is we want that adjustment to stay put and not just come right back out. And the process to do that is to get everything strengthened around it. So first, let's just see what your alignment's like. Check for any leg length imbalance. So we're just going to lift your legs up and bring you back down. So your left leg is actually a little bit shorter. I don't know if you'll be able to tell on camera or not, but it's just slightly short here.
Deformity.
Well, most of the time, that's actually just coming from a little bit of a muscle imbalance or the pelvis being out of alignment. Usually when somebody comes in, we have a little measuring tape and we'll measure their legs to see if you actually have an imbalance, but most of the time it's just coming from the muscles. So what we'll see here. Check the SI glide here. And we can see that your sacrum is actually not moving very well. So what we want to check is if I put my hand over your sacrum, try to lift this leg up as high as you can without bending your knee. Good. And drop that down. And over here. Good. So you're a little bit reduced on that left side. What we're going to do here is, this is called the drop piece. So this is really nice. Again, it comes from speed, not strength. So this piece drops down. When I push on your pelvis, it's quick. It doesn't mean I don't have to jump on your back and twist you up like a pretzel. So we'll go right here and get that back into place. Working around your mic back.
Yeah. And what tends to put this out of place?
So there's a lot of different muscles and bones and ligaments that can pull on that. It could be anything from sports. It could be from muscle weakness, like if your gluteus medius muscles are weak, that can allow things to shift. Having kids can also change that position too. So there's a lot of different things, and basically we need to figure out if this is a consistent problem, what's your issue?
Right.
And then either try to minimize that or at least strengthen you up so it doesn't pull you out all the time. So another instrument we have is called the arthrostim. So just to kind of show you, and you can use this on pretty much any part of the body, and it's really low force. So for you, generally I would probably still use my hands for your mid-back, But say if somebody came in and we're worried about their bone health, or if they had a certain thing like an old fracture that we really had to work around, you can use this pretty easily to put a little pressure in and actually get that vertebra moving again appropriately. Just like that. So you don't get that same pop and cavitation, but it still helps to move that in the right position again. So for you, if you have a posterior ponicle, I think is what you said.
Yep.
So a lot of high velocity motions in your neck wouldn't be the best for you. But using something like this where you don't actually have to twist or turn would be a lot better for you, a lot easier on your body. So we're going to go ahead and just scan through your thoracic spine a little bit more. And like right here, so I'll have you take a deep breath in and all the way out. There we go.
That's probably from children sleeping on me.
Yeah, I could say that. You can go and get up whenever you're ready.
Okay.
But yeah, so basically we have to figure out everybody's stressors and figure out, what do we need to add, what do we need to change. Getting the alignment's the important part at the beginning, and then it's just how long can we keep it there. So trying to figure out, can we change that? Can we strengthen anything so that when you're holding your kids, it doesn't bother you as much?
Right.
So then we go over typical things like core strength and getting your shoulders back and down, working on posture.
My son, when he had colic really bad, he was at the chiropractor like twice a week until we got that under control.
Yeah.
Then it was just maintenance. We went like every other week.
Yeah, absolutely.
But then when he got to be really rambunctious, she would say he was the only kid who could knock his alignment out before we left the office.
Yeah, we keep the tables a little bit lower to the ground when the kids come in, but
Yeah.
it's always really nice to hear families coming in and hear all the kids talking and running through the hallways and
can
things.
you work on kids too?
Yeah, absolutely. We love working with families, so I like helping patients through pregnancy and adjusting their kids when they're really young and through sports when they get older. And it's always kind of a fun little goal when you have a patient and their pictures in their chart and they've gotten so much older that you're like, wow, you were this tall when you first came in and we need a new picture. And they always like hearing that they're like 2 feet taller now. So it's always fun.
So I think we're going to go try another technique with a patient that's really cool.
Cool. Let's go.
All right.